Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Introduct, my name is Erika Priyatanti. I'm from Unisola. Here I will explain about a journal analysis with themes analysis journal about prophylactic laparoscopy, cholecystectomy in adult sickle cell disease patient with cholelithiasis, a prospective case study. Now I will explain. The first is the identify the PICO of the journal. Answer B. Patient postoperative patient undergoing cholecystectomy surgery. E. Intervention employing spirometer intensive oxygenation. C. Comparison. We have two complications associated with the surgery in very group, but in unscattered biliary. Outcomes. Our results show that prophylaxis cholecystectomy is a safe procedure and has less post-surgery. Next, how was the problem identified and formulated? Answer. Laparoscopic cholecystectomy is performed in general anesthesia and with the application of a thermal cuff air at 15 degrees Celsius for whole operation period. A pneumoperitoneum is made through the navel incision are in the left hypoatrium with further introduction of 10 mm drug for carbon insufflation dioxide at a pressure of 12 mmHg. Laparoscopic cholecystectomy done using standard 4 post techniques. Next, what was the objective of the study? Answer. Our objective was to evaluate the effectiveness of prophylactic cholecystectomy in ACD patient with asymptomatic gallbladder stents. The aim of this study is to demonstrate laparoscopy prophylaxis cholecystectomy has lower morbidity than cholecystectomy performed for symptomatic lithiasis. Next, what was the hypothesis of the study? It was not stated in the journal. Next, formulate the clinical question of the study. Answer. How it affect after undergoing cholecystectomy surgery. Next, what was where study design used by the researcher? Answer. The Department of Hematology at the University Hospital Tenon with about 700 hospitalization every year was certified as a reference center for the management of patients with amateur ACT in French. From January 2000, along with the hematologist and anesthesiologist, we decided to evaluate the usefulness of a prophylactic elective laparoscopy cholecystectomy prospectively for adult ACT patients who had asymptomatic cholelithiasis. The procedure management of this asymptomatic patient was carried out over a 14-year period from 2000 to 2000 period from 2000 to 2014. During the same study period, we have also added known on to emergency patient I4 acute cholecystectomy and the other for cholangitis with CBD stents. This was the only patient who had CBD stents diagnosa preoperatively by ultrasound. He was included because our objective was to evaluate the treatment of asymptomatic bladder lithiasis without complication. Emergency procedures were not included in this study. Next, when or where was the study conducted? It was not stated in the journal. Next, how were their setting and subject determined? How was the sample? Answer. During the same period, we also reviewed the record of 51 other ACT patients who underwent an elective laparoscopy cholecystectomy for symptomatic cholelithiasis. All patients had an ultrasound examination of the gallbladder and biliary tract and were diagnosed with gallbladder cholelithiasis without stenosis. The CBD and the group patient had any common dark stenosis that were diagnosed preoperatively. Next, what type of instrument were used in the study? It was not stated in the journal. Next, mention the introduction and exclusion criteria of the patient, inclusion criteria, exclusion criteria. Next, what type of instrument were used in the study? It was not stated in the journal. Next, mention the inclusion and exclusion criteria the patient. Inclusion criteria, exclusion criteria. Answer: 50 patient with asymptomatic cholelithiasis patient. Patient without prospective symptomatic associated with this study. An alproplectic cholecystectomy agreement with intraoperative choleograph asymptomatic patient are studied retrospectively after entering. Every patient are given a special preoperative management including intravenous hydration, antibiotic prophylaxis, oxygenation, and intervention painkiller, as well as substance revlomolecular with heparin during the sample. 51 patients with SCD received cholecystectomy. For symptomatic cholelithiasis, we compared two groups in post-operative terms: mortality, morbidity, and hospital treatment. He is excluded because our goal is for treatment consideration. Asymptomatic bladder lithiasis without complication, emergencies that the procedure was not included in this study. How was the study procedure conducted? Answer: our prospective study is the first in the medical literature which analyzed a large series of altered SCD patients who underwent laparoscopic cholecystectomy for asymptomatic cholelithiasis. The natural history of cholelithiasis in sickle cell patients seems to be different from the general population. Lithiasis occurs in a youth and 17% have smooth gallstones in SCD patient become symptom that come delayed cholecystectomy. We hypothesize that prophylactic cholecystectomy can reduce SCD-related complications. Observation in patients who have elective surgery for symptomatic cholelithiasis or emergency surgery. We observation no post-operative deaths in both groups. For SCD patient, we teach to the systematic intraoperative cholangiograph, but for the general population and non-SCD patient, we only did selective operative cholangiography using a valid multifactorial score that we built. Next, what was the data gathered? What gathered the data? Answer. All patients underwent ultrasound examination of the gallbladder and bile duct and were diagnosed with gallbladder cholelithiasis without stone in the CBD and in both groups. None of the CCD patients who had common canal stone were diagnosed before surgery. Of the 52 patients with asymptomatic cholelithiasis, 43 had homozygote hemoglobin. 4 has heterozygote has HbC cell hemoglobin. 4 have sickle cell disease, and 1 is related to thalassemia. Next, what technique of analysis were used by the researcher? Answer. Laparoscopy cholecystectomy is performed using a standard for technique. X2 test to compare preoperative and postoperative characteristics. Next, what were the results like? Answer. Result: there were no preoperative deaths or injuries to the bile duct in either group. Next, what were the strength and weakness of the study? Answer. For asymptomatic lithiasis, our results show that prophylaxis cholecystectomy is a safe procedure and has less post-surgery medical complication. Next, were there any side effects of the study? If there were, what were explained them? Answer. It was not stated in the journal. Next, what was the conclusion? Next, what was the conclusion? Next, what was the inclusion of the study? Answer. The series of 103 elective cholecystectomy included a group of 52 asymptomatic adults with SCD and cholelithiasis. To our knowledge, this study comprised the greatest number of asymptomatic SCD patients studied after a cholecystectomy. For asymptomatic lithiasis, a result showed that a prophylactic cholecystectomy is a safe procedure and has less post-operative medical complication. The material that I mentioned has been complete. Sorry if there is a mistake in the delivery of me. Thank you for attention and time in give it to me. Wassalamualaikum warahmatullahi wabarakatuh.